Good afternoon. Welcome everyone to the Senate Committee on Health and Human Services. Madam Secretary, please proceed to call the roll.
Senator Lang?
Here.
Senator Wynn?
Here.
Senator Stone?
Here.
Senator Titus?
Here.
Chair Doniate.
And I am here. Thank you so much. Please mark all members present. Good afternoon to everyone. Welcome to the last Senate HHS meeting of this session. I've been told this is the last one and the bills will be referred to Senate Finance after this. So hopefully it is. Who knows? We have 3 bills today. Assembly Bill 156, Assembly Bill 281, and Assembly Bill 460. Once again, the same housekeeping items apply as always. For folks that are presenting today, again, we ask to treat your bills like you're in Senate Finance. Keep it short and sweet. We have limited capacity for folks that would like to testify. The rules for today are the presentations are capped at 5 minutes each. Testimony will be capped at 1 minute for each person, and we'll see how far that takes us. If you don't have the capacity to testify either in support, opposition, or neutral, the option is always there to send your testimony to our committee staff, and you can always contact our committee secretaries. And anyone who wishes to receive copies of the items that we'll be talking today can be retrieved from the Nevada Electronic Legislative Information website. Let's start with Assembly Bill 156. I'll go ahead and open the hearing on this bill. This bill revises provisions relating to substance use disorders, and we have Assemblyman Ornlicker with us, so please proceed when you're ready.
Thank you, Chair, members of the committee. Assemblyman David Ornlicker, District 20 in the southeast side of Las Vegas. Assembly Bill 156 is designed to improve access to treatment for persons with substance use disorder. There was as you've heard many times, more than 100,000 Americans die each year from overdoses. And while there are treatments available to address substance use disorder, many people don't receive them. According to an article recently, only about 1/4 of people who would benefit from medications designed to address substance use disorder actually receive them. And so this bill provides a number of paths to improve access to treatment. So let me go through the provisions. First, one is to address overdoses acutely, and that is to create a bulk purchasing fund for the state for naloxone and other opioid antagonists. So when we're purchasing naloxone and other antagonists to reverse overdoses, we can do it more cheaply. Second, there's a provision that when we spend public funds to treat alcohol or other substance use disorders, the State Board of Health will have authority to expand the priority list. The federal government already says you have to prioritize pregnant injecting drug users, pregnant substance abusers, injecting drug users, and if we want to expand that priority list, we're giving the State Board of Health authority, although hopefully we reach everybody. Okay, here's one of the major provisions is once somebody is diagnosed with an opioid use disorder, healthcare practitioners will have to inform the patients about the availability of medication to treat it. And if the patient wants a prescription for medication-assisted treatment, either offer the prescription or refer to a practitioner who can prescribe if they don't have prescription authority. And there's, as you can see, several provisions repeating this because there are different practitioners we want to apply it to. Physicians, physician assistants, advanced practice registered nurses, and you see the list. We want it to be comprehensive and making sure that once somebody is identified as having a substance use disorder, they get a prescription for medication. Okay, here's another important one. Not everybody has a healthcare practitioner, but they still may need treatment. And so the next provisions allow for specially trained pharmacists to diagnose substance abuse disorder and to prescribe medication-assisted treatment like we already do now for HIV prophylaxis. And health insurers, including Medicaid, must cover medication-assisted treatment for substance use disorder, including when prescribed by pharmacists. And then finally, and this part may be superseded by a Senate Bill 35, and that is to require DOC and local jurisdictions to study the provision of medication-assisted treatment of prisons, jails, and other detention facilities, because we know prisoners, there's a significant number who have substance use disorders and not getting treated. But Senate Bill 35 calls for the provision of treatment, so that may supersede this provision. There is a conceptual amendment. Most of that is to make sure what we've got here works. For example, the pharmacy board needs conforming provisions to make sure that pharmacists can actually prescribe medication-assisted treatment. We removed a provision regarding Medicaid to eliminate a fiscal note that it would have basically would have prevented them from using their preferred drug lists, and we didn't want to change that. So that section 5.8 is deleted. What else did we do to conform? I think those are I think there may. There's also something from CVS to one of the complications is if we say that insurers have to reimburse for this, when you're dealing with pharmacists, sometimes you just pay the pharmacy, and so just say having that treated like other practitioners where you pay for the physician's services, then you pay for the prescription, may not work as well for pharmacists and pharmacies. So we've got a proposal, conceptual amendment from CVS to make sure that the Board of Pharmacy can sort this out through regulation. And Senator Stone, I think, has worked through this on another bill, so probably knows more than I do about it. I think those were is there?
Thank you so much, Assemblyman. Let me just clarify for the record, so I know the committee members have different documents. So, all right, just to clarify, so this is the mock-up amendment that was submitted by the Assemblyman. As he mentioned, there are provisions of the bill that he has stricken, specifically Section 5.8.
Section 5.8 is out.
Thank you. And he has reflected the concerns of Medicaid, et cetera, on his mock-up amendment. You have this language that it says amendments to AB 156/draft, adding blue language. So this is the amendment that was submitted by the Board of Pharmacy. It is my understanding from our legal counsel that those amendments are already reflected in the mock-up. And then you have this one that it's mostly in blue text. It says amendment to Assembly Bill 156, amend as follows and conform each change throughout the legislation. This is what the Assemblyman is referring to from the folks from the insurance groups, et cetera. So the bill mock-up that he has already reflects the amendment from the Board of Pharmacy. There is just a different amendment that is being represented from some of the stakeholders in addition to what he has presented. So I would essentially say that you can look at this one as your main one, and this is from the outside group. Yeah, this is the main one that we're looking at right now. And this is, if you have questions to the industry, this is the one that you would ask. All right? Yeah. That concludes your presentation?
Yes.
Thank you so much. Do we have questions on the bill? Senator Titus.
Thank you, Mr. Chair. Thank you for bringing this forward. I understand the opioid crisis is real and combating it is good. I have several concerns, however, more questions, I guess. We recently addressed the concern with a corporate practice of medicine. You don't want doctors hired, raises costs, and wherever your philosophy is on that. However, are there any independent pharmacists anymore? Are not all the pharmacists employed by the pharmacy or big industry, and yet we're going to allow them to diagnose a problem and then treat it and then pay them? How does that work? No, I'm asking.
Dr. O, if you want to try answering that, and then if not, we can have our legal counsel also specify. Please proceed.
Yes, thank you. Senator Titus, through you, Chair. Yes, that issue has been raised, and that gets to why we have the amendment to deal with the reimbursement. How do we, the goal of this is not to allow pharmacists to set up independent practices. It's so that when you need treatment, you have a substance use disorder, you don't have a relationship with a physician or a nurse, you can go to your local CVS or other pharmacy and have the pharmacist, who already, as you know, pharmacists give a lot of medical information to patients, to add this to their toolbox, just as they do with HIV prophylaxis or contraceptives, to be able to say, do the assessment and then prescribe, so that we just increase access.
Right, just to be clear though, certainly pharmacists can dispense, certainly they can, but this would require a diagnosis of opioid disorder. So you're making a diagnosis, and I just wondered, and then you're treating, and I'm just concerned if that's that. Certainly pharmacists can give injections and training and do pro times and know if the Coumadin level is correct, but they didn't make the diagnosis of a DVT before they gave the person the Coumadin. So this is a little different than that. So I'm just curious about the current practice and other nationwide. Is this something that they are doing now? Are they making these diagnoses?
Assemblyman Orient-Licker for the record. So if you look about, I think there are as many as 40 states that do something like this. And just before I get to that, these are specially trained pharmacists. It's not just any pharmacist. They do have special training. And once they have the training, there are about 40 states that allow this if they've got a collaborative practice agreement with the physician. And there are about 10 states that do this without the collaborative practice agreement. And I know Massachusetts on Tuesday will be considering exactly to do this too.
Great, thank you so much. Any other questions, Senator Stone?
Thank you, Assemblyman, for your presentation, and I appreciate your vision, because what we're seeing is the evolving of our healthcare system, and I appreciate that legislatures are finally recognizing the utility and value of the education that pharmacists have. They're commonly referred to as the most educated, underutilized healthcare professional, and there's no question that opiate addiction is an epidemic in this country. The advantage to expanding the assistance of a pharmacist, like you would a physician or nurse practitioner, is their 24/7 availability. And I'll also mention this, that a lot of people don't know this, but the Gallup organization rates the most trusted profession every single year. And it's interesting to note that the pharmacy profession comes in #1 every single year, even above the clergy, which is kind of interesting. So people really trust their pharmacists, and they trust their physicians as well. But I think that the accessibility with pharmacists that are specially trained, you can do residencies and you can get special education and work with a collaborative agreement with a physician. Pharmacists know this stuff, and it probably doesn't take a lot of ingenuity to make a diagnosis that somebody has a opiate problem, and it's basically a one-stop shop. This is similar to a bill that I brought forward with Senator Scheibel that allows a pharmacist to prescribe oral contraceptives, get paid for that service, and then they get paid a dispensing fee for dispensing. It's two different services. And then to answer my colleague's concern, she's absolutely right that we've seen the corporate takeover of pharmacy. Unfortunately, there's not many independents.
Senator Stone, I love your commentary, and
Yeah.
I don't want to cut you off, but we are in a time crunch.
I'll go quick.
So do you have a question that you want to ask him, please?
I'll go quick. That there are not a lot of independent pharmacies left, but there are some. And so the point I was going to try to make is that I think you've already kind of said, I just want to codify it, is that I don't see pharmacists hanging a shingle saying that we are an opiate professional advisor. Come in here, we're going to diagnose you, we're going to give you prescriptions for methadone or whatever we're going to give you. This is basically going to be targeted more towards, it could be a clinic, It could be a clinic that hires a pharmacist, but also getting these pharmacies that are readily available to basically be a one-stop shop. So if you can just comment on that.
That's exactly right. David Liquor, for the record, exactly as you describe it, too. For we've got existing pharmacies and just one convenient 24/7 one-stop shopping.
Thank you.
Thank you so much. Are there any other questions for this bill? Seeing none, let's go ahead and open up to testimony. If you are in support of this bill, please come forward. Once again, we'll be limiting testimony to 1 minute each per person, 10 minutes total, for 10 for support, 10 for opposition, 10 for neutral. Let's begin here in Carson City. Please begin.
Hello, thank you, Chair. My name is Elise Monroy Marsala. I'm here today on behalf of the Nevada Public Health Association. We support Assembly Bill 156, but I'm here today specifically to speak to our support for the bulk purchasing provisions. Exempting the naloxone purchasing from the bureaucratic requirement of state budgeting is something that has to happen, frankly, in the state. Nevada currently relies on categorical grant funds from the federal government to support almost all of its public health initiatives. The current budgeting requirements to administer dollars create significant delays in getting funds flowing to support programs at the state and local level. We at NPHA hope to see the legislature support funding for unrestricted public health programming, but in the meantime, we also support taking these steps to make sure that public health programming is more nimble, and we urge your support of this bill. Thank you.
Good afternoon, Chair. For the record, my name is Joelle Gutman-Dodson with the Washoe County Health District, and I just want to say we support this bill. We support any sort of access to substance abuse treatment and prevention. Thank you.
Good afternoon, Mr. Chair and members of this committee. Liz McMiniman, Retail Association in Nevada. I just wanted to get on the record that I support the direction that this bill is going in, and I appreciate the sponsors of this. Pharmacists are a healthcare provider, and we really want to see them utilized. I think they bring more access to healthcare for the patients in Nevada. So with that, I appreciate the time.
Good afternoon, Chair Doniate, members of the committee. For the record, my name is Jimmy Lau with Ferrari Reader Public Affairs, representing Dignity Health St. Rose Dominican, here in support. Thank you.
Thank you so much. Is there anyone else in Carson City in support of this bill? Seeing none, BPS, is there anyone virtually?
Yes, this is Kaylyn Bowman, KAYLYNNBOWMAN, and I am currently the president of Nevada Pharmacy Alliance, and I'm here to provide support of the AB 156 bill that we are committed to ensuring the safe and effective use of these medications and to work collaboratively with other healthcare providers to provide the individuals who need this help the assistance that we can. We would urge you to support AB 156 at this time, and thank you.
Hello, my name is Amy Hale, and I'm a pharmacist here in Nevada, speaking on behalf of myself, and I strongly support AB 156. We do have quite a number of pharmacists in the state who work outside of retail settings, such as in ambulatory clinics, and pharmacists are doctorate-level educated medical professionals, which nurse practitioners and physician assistants are not, and this bill requires us to have further specialty training. The passage of this bill would allow pharmacists to support patients at a higher level in independent clinics or in continued conjunction with providers and expand access to care for the people of this state. Thank you.
Chair, there is no additional testimony at this time.
Thank you so much. Let's move on to opposition. Is there anyone in this room in opposition to this bill? BPS, is there anyone virtually?
If you would like to testify in opposition to AB 156, please press star 9 to take your place in the queue. Chair, there are no callers choosing to testify at this time.
Thank you so much. Is there anyone in this room that would like to testify in neutral on this bill? Please come forward. Seeing none, BPS, is there anyone virtually?
If you would like to testify in neutral for AB 156, please press star 9 to take your place in the queue. Chair, there are no callers choosing to testify at this time.
Thank you so much. In the interest of time, I am going to go ahead and close this hearing. It sounds like our legal counsel, Mr. Robbins, and I have to meet with the folks that wrote one of the conceptual amendments, and so we will work to get something to you all that looks like the proper work session document, and so hopefully we might have to work session this bill behind the bar. So I just wanted to give folks the clarification. If you have any advice on what you would like reflected on the work session document, please communicate that to us, but we will have to address a few technical errors outside of this committee. Let's move on to the next bill that we have. We have with us Assembly Bill 281. I'll go ahead and open the hearing on this bill. This bill revises provisions governing senior living facilities, and we will invite Mr. Soltero to present this bill. Please begin when you're ready.
Thank you, Mr. Chair, members of the committee. For the record, Randy Soltero, here today to present AB 281. In the 2021 session, we did a bill that provided for clean air standards in schools here in Nevada. That bill passed, and I could tell you that Clark County School District utilized the funds that were available, federal funds that were available, to make it a no cost to the school district to provide this retrofit, if you will, of those schools. Also, there were several schools throughout the rural part of the state. One story I could tell you quickly is that I had a gentleman call me from, I believe it was in Lander County. They had a school that they used these funds to actually put an entire ventilation system into their school, which they didn't have before, and then to have clean air standards. As AB 281 kind of expands that program and includes it into senior living facilities throughout the state, again, which would make these facilities have better air quality. You know, since the pandemic, the air that's in these different facilities is sometimes is not as good as it should be. I know my friend, I'm not sure if he's here today, I know it's been short notice, could tell you, and he would monitor this room. Dr. Irvin from the Faculty Alliance would come, and he actually in the first hearing monitored the room and showed that there was not a acceptable level of clean air in the hearing room that we presented in the assembly. So anyway, this bill, going through the parts of the bill, the first parts of the bill are mostly definitions, talking about what kind of standards it would be that this bill would cover as far as retrofitting a facility to make it a clean air facility. It's more than just buying the good filters and installing the better filters. It's actually retrofitting a facility more along the lines, not as intense as like a hospital, but more of a clean facility. What this applies to is senior living facilities. If you look at Section 12, senior living facilities means any facility that receives any federal funding from Medicare, Medicaid, or other federal health care programs. And this is the thing, this bill is limited to only facilities that deal with Medicare, Medicaid patients, or residents. Furthermore, on that section, I'm sorry, further down, section 16, and this I think is the most important part. To the extent that money is available, the administrator of a senior living facility shall ensure that the senior living facility is equipped with a functional ventilation system that is tested, adjusted, and if necessary or cost-effective repaired, upgraded, or replaced. So this program, the way that this program is funded, there is a lot of money out there from leftover ERISA funds, infrastructure funds that are out there that are for specifically indoor air quality, not just for schools, but then now you can use them for senior facilities. There's funds available out there. We have a resource that actually, a department that can help in assisting in applying for those funds, and they are up and ready and willing to help any facility that would like to do this. I'd like to also offer that we've been asked to accept a conceptual amendment, and Senator Donate, should I ask you to address that?
Thank you so much. So that is correct. I have asked that a conceptual amendment be submitted on my behalf for the provisions of this bill to only apply to populations of 100,000 or more. So it would reduce it just to Clark and Washoe County.
Yes, and I actually spoke with some folks earlier today and talked to them about that, and they were pleased to hear that, and we are accepting that amendment, that so the rural counties, some of them, it would be, they would not have to be bound by doing this program, but if they did want to, they could participate. Also in the bill, this bill, the original language we did, we made an amendment for nonprofits as well. So,
thank you so much, Mr. Soltero.
Thank you so much.
We'll go ahead to committee questions. Vice Chair Nguyen.
You had mentioned something about how there's potentially funds out there to do this. With the amendment and that population cap, would those rural communities or nonprofits still be eligible for those funds if they chose to try to seek them out to have these kind of conversions?
For the record, Randy Soltero, yes, any facility that wants to apply for those funds as they are available. Those funds aren't going to last forever. Those funds are going to run out, and when those funds run out, this program will sunset. But yes, Senator, if any facility that wants to, a bona fide program can apply for these funds, and it would cover the cost, the entire cost of the retrofit.
Thank you so much, Senator Titus.
Thank you, Mr. Chair. A couple questions. It's my understanding that there, after you testified in the Assembly side, there has been some research and deep dives into the funding sources you've mentioned, and they do not exist. And so I'm questioning where we can find other documentation, because certainly the hospital facilities looked at what you had referred to, and your analogy to the schools. Yes, that happened in schools, but those COVID funds are no longer existing. The funds that you say are available are not available. So I'm just wondering, if there's no funds available, then this is a moot point, because you just said that this would sunset when no funds were available. Is that written in the bill, legal?
Yes, Eric Robbins, LCB Legal. That is section 23. It says, this act becomes effective upon passage and approval and expires by limitation on the date on which the Director of the Legislative Council Bureau receives notice of a determination by the Administrator of the Division of Public and Behavioral Health of DHHS that there is insufficient federal money available to facilitate compliance of senior living facilities with the provisions of this act.
So if it's going to be the obligation, Section 23 of the Division of Public Health, to let us know, do we have a statement from them now that they're, because again, it's one of these opinion things, do they have a statement that says, since they're in this bill, that there are indeed current funds available?
Eric Robbins, LCB Legal, for the record. I have not communicated with them on that, so I don't really know what they would say.
Are they here by any chance?
I don't see any representative, but we'll make sure to, is there?
Good afternoon, Chair Donate and committee members. My name is Kyle Devine, and I am the Deputy Administrator over Regulatory and Planning for the Division of Public and Behavioral Health. When we first saw this bill, we did a quick search to see if we could identify funds. We are not currently aware of any funds. However, I have discussed this with our administrator, and we are willing to continue looking for those funds throughout this next year.
So you've looked so far. There are none that you're aware of. You're committed to keep looking, however? Is that what I just heard you say?
Chair, through you to Senator Titus. Yes, we will, for a reasonable period of time, continue looking for those funds, and at a time when we believe they are exhausted, we will provide the report to the Legislative Council Bureau.
Right. Just a comment then. I would say that we hold off on this bill until we can document there's funds available, until the times funds are available.
Thank you so much. Vice Chair Nguyen.
If we have this enabling language and funds do become available, then we would be able to use them. Is that correct? I guess for whoever might be in the best position to answer that.
Kyle Devine for the record, through you, Chair, to Senator Nguyen. Yes, if they become available, and we have not yet notified the legislature that they are not available, we would allow those to, or they would still be available.
Thank you.
So, thank you so much for that. So I wanted to clarify, and perhaps our legal counsel can also chime in as well. The bill, from my understanding, in terms of reading it, says that if the money is available, based on Section 23, if the money is available, then these are the procedures that they would follow. It's not, you got to follow these procedures and figure out where the money's, if the money's there. But maybe our legal counsel can.
Yeah, Eric Robbins, LCB Legal. It's actually the provision from Section 10 that he read earlier. It says, to the extent that money is available, the administrator of a senior living facility shall ensure that the senior living facility is equipped with a functional ventilation system, et cetera, in accordance with the provisions of this act. And so if there's no money available for them to do so, the obligations of this bill don't apply.
Thank you so much. Any other questions? Senator Stone.
Thank you. Mr. Soltero, thank you for your presentation. I appreciate it, and certainly hope that they are able to find some federal funding. It sounds like they haven't been successful so far, but assuming that there is federal funds available, will these long-term facilities be required to do these HVAC upgrades?
For the record, Randy Soltero, the language in the bill does say shall. The amendment that we are doing is to put a pop cap to where it would be only counties that were over 100,000. So it would eliminate the rural counties that, and again, in conversations with them to help them out, not all of their facilities would be able to want to do this, and so that's what it would be to do that.
Okay, so then if I understand you correctly, in counties that have a population of 100,000 or more, if federal funding is available, they shall be obligated to do these HVAC improvements?
Yes.
Okay.
For the record, Randy Soltero, yes.
And are long-term facilities only required to follow the procedures contained in this bill if they use federal funding specifically set aside for HVAC systems?
For the record, Randy Soltero, yes. The provisions in the bill actually very much describes a way that would be properly done using federal standards to make sure that there was a clean air environment in those facilities, similar like we did with the schools. Again, as I said in the beginning, it's not just putting in the good air filters this time. You have to actually go through and use their proper equipment and everything to provide and make sure that there is a safe and clean air in those facilities.
And just one last question, Mr. Chair. Are there any federal clean air standards that are required for such facilities that would preempt the necessity of this bill?
For the record, Randy Soltero, we're not aware of any provision that would preempt this, but we did use the federal standards in setting the guidelines for this clean air bill.
Thank you.
Thank you so much. Vice Chair Nguyen.
Just more of a comment. Just to clarify, this is just enabling language. I know a lot of times, sometimes we don't have that language in there, and so we're not able to capture and spend federal dollars that may become available to either convert or upgrade or put in some of these things, and this just allows for that. Is that correct?
For the record, Randy Saltero, yes, ma'am.
Thank you so much. That concludes our round of questions. Let's move on to support testimony. So if you are in support of this bill, please come forward. Once again, 10 minutes for support, 10 minutes for opposition, and 10 minutes for neutral, and testimony is capped at 1 minute per person. And me too is fine, or ditto.
Thank you, Chair, members of the committee. For the record, my name is Susie Martinez, the Executive Secretary Treasurer of the Nevada AFL-CIO, and on behalf of over 150,000 union members and 120 unions, we are in full support of the bill. Thank you.
For the record, my name is Mark Ellis, Communication Workers of America, Local 9413. On behalf of our retirees, ditto.
Kent Irvin, Nevada Faculty Alliance. Indoor air quality is really important if you want an offline story about why CO2 monitoring, carbon dioxide monitoring is so important for respiratory virus and indoor air quality. I can tell you. Thank you.
Thank you so much. Is there anyone else to support? BPS, is there anyone virtually?
If you would like to testify in support of AB 281, please press star 9 to take your place in the queue. Chair, there are no callers choosing to testify at this time.
Thank you so much. If you're in opposition, please come forward. Are there, oh, you got some folks?
Joan Hall, President, Nevada Rural Hospital Partners, here in opposition with the bill as it's written, for the reasons that personnel specified aren't readily available in rural areas, and our research has not found any funding opportunities, either in the energy area or federal dollars. However, with the amendment, if it were to pass, we could go to neutral. Thank you.
Thank you so much. Is there anyone else in opposition? BPS, is there anyone virtually?
If you would like to testify in opposition to AB 281, please press star 9 to take your place in the queue. Chair, there are no callers choosing to testify at this time.
Thank you so much. Is there anyone in neutral on this bill? Please come forward.
Hello, thank you for this opportunity. I'm just by chance in the building, and I do hold a residential facility administrator's license. My biggest concern when I listen to this bill,
Name for the record, please.
Ovidia McGinnis,
Thank you.
is that even in the populations where it's over 100,000, we have to consider those Medicaid waiver beds and what this will do to them if it shall. Because as it is, they're receiving like $900 a month to care for these patients, and they're barely making it. So I just say proceed with caution when they shall do it. Thank you.
Thank you so much. Is there anyone else in neutral? BPS, is there anyone in neutral?
If you would like to testify in neutral for AB 281, please press star 9 to take your place in the queue. Chair, there are no callers choosing to testify at this time.
Thank you so much. At this time, I'll go ahead and close the hearing on AB 281. Again, I have an amendment to put a population cap of counties of $100,000 people or more. So I will go ahead and entertain a motion to amend and do pass with that amendment.
Also move to amend and do pass with that amendment.
Thank you. So we have a motion from Vice Chair Nguyen to amend and do pass. Do we have a second? Second from Senator Lang. Any discussion? Senator Titus.
Thank you, Mr. Chair. I will be a no in this. I really feel strongly we truly have the cart before the horse here. If these are needed in medical facilities that take Medicare patients, CMS really is controlling that. We should not be putting this into our state regulations. They will have the option to apply for these if they become available, and putting this into a NRS, I think, is just not appropriate. So I'll be a no. Thank you.
Thank you so much. Any other discussion? All right, moving to the vote. All those in favor, please say aye. Aye. Any opposition? We have an opposition from Senator Stone and Senator Titus. The motion is carried, and I'll go ahead and take that floor statement. Let's move on to our last bill, is Assembly Bill 460. I'll go ahead and open the bill hearing on this bill. This bill revises provisions relating to nursing pools. It says bills on my document. We have Mr. Schubert, so please proceed when you're ready.
Good afternoon, Chairman, members of the committee. For the record, I'm Paul Schubert, Chief of the Bureau of Healthcare Quality and Compliance within the Division of Public and Behavioral Health. AB 460 is a state agency-sponsored bill. This bill was generated with the following intent: revision of the definition for nursing pool to only include a person or agency which provides, through its employees or by contractual arrangement, infusion therapy or private duty nursing services to a natural person. The revision exempts from that definition a nursing pool providing staff for a medical facility or facility for the dependent. And reprint number 1 clarifies licensed private employment agencies and licensed professional employer organizations are exempt from licensure and regulation as a nursing pool. AB 460 revises outdated licensure category to better reflect current times. AB 460 eliminates licensure burden to staffing agencies that provide staff for medical facilities or facilities for the dependent. The revision recognizes contract nurses working in medical facility or a facility for the dependent would be subject to applicable statutes and regulations governing the facilities themselves, and also recognizes licensed nurses are subject to the statutes and regulations governing nursing practice under the oversight of the Board of Nursing. This concludes my introduction, but I remain available to answer any questions.
Thank you so much. Committee members, do we have any questions on this bill? Seeing none, I'll go ahead and open it for testimony in support. If you are in support of this bill, please come forward.
Good afternoon. Joan Hall, representing Nevada Rural Hospital Partners. We are in support of this bill. The way it is currently, the hospital who is using a nursing pool has to guarantee that that pool is licensed in Nevada, so it's multi-stepped for them. Sometimes it's difficult to find that list. I know it's supposed to be easy, but it's not, and so we could be hiring people from a pool that was not licensed in Nevada. The nurses are, but the pool was not, so we're in support.
Thank you so much. Anyone else in support, please come forward. BPS, is there anyone virtually?
If you would like to testify in support of AB 281, please press star 9 to take your place in the, in support of AB 260, please press star 9 to take your place in the queue.
BPS, just want to double check. 460, AB 460.
Yes, Chair, my apologies. To testify in support of AB 460, please press star 9 to take your place in the queue. Chair, there are no callers choosing to testify at this time.
Thank you so much. Is there anyone in opposition to this bill? Please come forward.
Thank you, Mr. Chair and members of the committee. My name is Marlene Lockhart, and I'm representing SEIU 1107. We oppose AB 460 for several different reasons. But we would like to put on the record that the development of gig or Uber-type nursing pools where healthcare facilities hire nurses on a temporary, on-demand basis may seem appealing at first glance. It is important to critically evaluate the potential negative consequences associated with gig nursing pools. One of the fundamental principles of healthcare is the establishment of a strong patient-nurse relationship based on trust and continuity of their care. Licensing and regulation ensure that nursing pool providers adhere to standardized guidelines and protocols, maintain appropriate staffing ratios, and undergo regular inspections to ensure compliance with quality standards. These measures safeguard patients against potential negligence, abuse, and other forms of malpractice. Removing these protections would leave patients exposed to unacceptable risks, undermining the public's trust in our healthcare system. Licensing and regulation contribute to the professionalization of the nursing workforce. They promote ongoing education, training, and certification requirements, which are vital for maintaining and improving the skills and knowledge of nursing professionals. By exempting certain providers from these requirements, we risk creating a two-tiered system in which the quality of care provided by licensed and unlicensed providers differs significantly, further exacerbating health disparities and inequality. I understand the argument that excessive regulations can stifle innovation and hinder the growth of nursing pool providers. However, we must strike a balance between the regulatory oversight and fostering innovation. Instead of excluding providers from licensing and regulation entirely, we should focus on creating a more streamlined and efficient regulatory framework that encourages innovation while upholding patient safety and quality care. I urge you to reject this bill that seeks to exclude certain nursing pool providers from licensing and regulation. Patient safety should always be our top priority, and any attempt to weaken the oversight of nursing pool providers undermines the integrity of our healthcare system. Thank you.
Thank you, Ms. Lockhart. I think we have a question from Senator Titus, if it's okay.
So thank you for that presentation and representing the folks that you do. Just a comment that you made. So the people that have these nursing pools, they're really a supplier, not a provider. The nursing pool itself then supplies the nurses who then have to work in facilities that are regulated, and it's up to the facilities to make sure that they follow those regulations. So tell me how the pool itself, since it's not that agency, it's basically an employment agency, they're not giving care, they're doing supplying a product, a person, a nurse, that then works in a facility that has regulation. So I'm not so sure
and perhaps I can answer
because I don't really administer care.
So that was a question that I had, and it's been within the last 2 days I've been meeting with folks, different stakeholders. So just a background as to what I believe the bill is, and perhaps our main presenter could allude to this as well. The rationale for this bill, and I also have, just for a reference point, I was waiting until after the bill presentation, which I will make the disclosure that finance gave to me for the record. my understanding of why this bill is in front of us is because there are these groups and entities that we can consider as third parties that operate as you would say, employment agencies. And so there's this gray area as to what the department has the ability to enforce and what it doesn't have the ability to enforce. So this organization so if it's employing them like a facility would, then obviously DPBH should come in and enforce them. They can apply administrative penalties, they can revocate their license. But because this organization does not employ them and they're kind of this matchmaking service, the question then comes to what is the appropriate enforcement mechanism for any malicious activity that they have? Is it under the department? Is it, for instance, the labor commissioner? Is it their attorney general's office? Is it DPPH? And if it is, how do you enforce a law or a license if they don't have a direct presence in this state? And so it's, you start to fall into employment law and kind of this gig worker capacity, and to what you're saying is, I think the perspective of the presenter was their policy initiative was perhaps it might just be easier just to exempt these type of organizations from nursing enforcement. Yeah. So that's my understanding as to what the rationale was as to what it led to. But of course, by doing that, you still have this gray area of what this entity is, and other states are falling into the same perspective policy-wise as to how do we look at this term of gig nursing. So, Ms. Lockhart, I don't know if you have anything else.
Yes, I would like to add that the bill states infusion or private duty nursing services to any natural person. That doesn't mean that person getting care would always be in a facility or a hospital or a nursing home. So if they are not supervised by professional medical care, and a staffing gig agency is not equipped to supervise nurses, in our view.
Thank you so much. Let's go ahead and move on to the next.
Thank you, Chair. For the record, my name is Susie Martinez, and I am the head of the Secretary-Treasurer of the Nevada State AFL-CIO, and on behalf of over 150,000 members and 120 unions, we are in opposition of the bill for the exact same sentiments that the previous speaker had. Thank you very much.
Anyone else in opposition? Oh, very good. Please proceed.
Mark Ellis, Communication Workers of America, Local 9413. On behalf of our 700 St. Mary's employees, we oppose this.
Thank you so much. Is there anyone else in opposition to this bill? BPS, is there anyone virtually?
If you would like to testify in opposition to AB 460, please press *9 to take your place in the queue.
Hello, my name is Chris Nielsen on behalf of the National Nurses Organizing Committee, National Nurses United, and the over 3,000 nurses we represent in Nevada. I'd like to voice our strong opposition to AB 460. We believe AB 460 would degrade the quality of care the patients receive and put them at risk, that it would erode nurses' job quality and open the door to unregulated Uber for Nurses type gig platforms that would deprive registered nurses of essential protections. Gig nursing platforms like CareRev, for example, a supporter of this bill, take a page out of the Uber and Lyft playbook, whose business models we know depend on misclassifying workers as independent contractors, depriving them of benefits and work law protections granted to regular employees. AB 460 would also lift requirements that staffing platforms and agencies verify nurses' qualifications and competencies, which would presumably fall to the contract medical facility. But we've heard from, our union has heard from nurses across the country and other states that this often fails to happen, and gig nurses supplied through these platforms and agencies are frequently unprepared and unqualified for the work that they're contracted for. This leads to delays in care and increases the burdens
Thank you
on
so
core
much, sir,
staff,
for your comment. If you
and
can please wrap it
will
up,
only
please.
exacerbate the nurse staffing crisis. Sure. So for all of these reasons, NNOC and NU opposes AB 460, and we respectfully urge you to vote no. Thank you.
Good afternoon, Mr. Chairman, members of the committee. For the record, my name is Liz Sorensen. I'm with the Nevada State AFL-CIO, and I'm here today strongly opposing AB 460. I urge this committee to do the same. Thank you for your time.
Good afternoon, Chair and members of the committee. My name is Russ James, R-U-S-S-J-A-M-E-S. I'm with the Nevada AFL-CIO, longtime member of the Painters and Allied Trades, also strongly in opposition to AB 460, urging the committee to oppose it as well. Thank you.
Good afternoon, Chair. This is Dion Klug, D-I-O-N-N-E-K-L-U-G. I am with the United Food and Commercial Workers Union, Local 711 in Las Vegas, and we strongly oppose this bill. Thank you.
Thank you, Chair Donato, for allowing me to address the committee. My name is Edward Goodrich, E-D-W-A-R-D, G-O-O-D-R-I-C-H. And although I represent the IATSE Local 363 in Reno, I am here on my own behalf today. I am a victim of medical malpractice. As such, I take a personal interest in this type of legislation. Throughout the session, I have heard repeatedly that it is the goal of this legislature to increase employment and the quality of living for Nevadans. I don't see AB 460 doing that. This bill seeks to undermine the quality of the nursing program at Orvis School of Nursing at UNR. It does this by encouraging the lowest common economic denominator for nursing pools. To be sure, the language presented in the new sections F and G address only the licensing of an employment agency with the Labor Commissioner along with babysitters, who are mentioned within the same main section at 611.020. It assures nothing concerning the quality of a professional referred by an agency. It has nothing to do with the quality or professionalism or even licensing for the profession. A licensed nurse referred by an agency could hold a license from a questionable licensing jurisdiction, not necessarily in the United States. To me, this legislation can be read to bring
Thank you so much, sir, for your comment. If you can please wrap them up.
You got it. This type of legislation will cause the graduates of the Orvis School of Nursing to flee the state for better compensation at graduation. Does the committee want to do that? I strongly oppose AB 460 and encourage the committee to vote it down. Thank you.
Thank you so much, sir. BPS, is there anyone else in opposition?
Yes, Chair, one moment. Caller ending in 348, please use *6 to unmute yourself and begin. Chair, it looks like the caller is not unmuting to speak. Would you like to proceed and move forward?
Yes, please.
Chair, there is no additional testimony at this time.
Thank you so much. If the caller comes back, just let us know, and then we can have them speak during public comment or as we proceed. Is there anyone in neutral on this bill? Seeing none, BPS, is there anyone virtually?
If you would like to testify in neutral for AB 460, please press *9 to take your place in the queue. Chair, there are no callers choosing to testify at this time.
Thank you so much. At this time, unless our presenter, did you have any other comments?
If I may, and thank you very much
sir,
for
please.
allowing us the opportunity to present this legislation. I just wanted to bring attention to the fact that this legislation, well, as the chair indicated, gig platforms already exist and we don't have the ability to regulate them. So this legislation doesn't remove any authority for regulating those entities right now. Likewise, it does retain the requirement for infusion therapy and private duty nursing services to be licensed, so long as those services are being provided to a natural person. And finally, the requirements for healthcare facilities remain the same, and we would still be regulating those facilities with regards to their nursing services. And the Board of Nursing would still be regulating the nursing professionals with regards to the Nurse Practice Act. And that would conclude my remarks. Thank you.
Thank you so much, sir. I did have a few remarks before the end of this bill presentation. So first things first, AB 460 is a budget implementation bill. The remarks that I received from the fiscal staff, which I wanted to put on the record, is in closing the DPBH healthcare facilities regulations budget, the Money Committee's approved Decision Unit E225, which reduced licensing fee revenue authority in the budget by $343,148 over the 2023-2025 biennium. The change to the definition of nursing pool in AB 460 would reduce the entities identified as nursing pools, which means fewer entities would pay a licensing fee to DPPH. However, since there is no money in the bill and it just seeks a policy change to conform with the budget closing decision, it is up to our committee to decide whether or not the bill would proceed forward. Having said that, if AB 460 does not pass, it would just mean that DPBH will continue to collect revenue than what was originally budgeted. I believe that there are questions of this policy sector that still remain outlying, and given the timeline that we have within the legislative session, I believe it is not appropriate to move forward with this bill. Gig nursing, as we know, is a new upcoming sector throughout the nation. I actually wrote down in my notes app, fix gig nursing. So I think there are a lot of discussions to be had in the interim for this particular capacity. I think there is a potential to explore this as other states have, but there are a lot of issues that are, of course, coming in with lawsuits all across the coast. So with that, we'll go ahead and close the bill hearing for this bill, and we will move on to the last agenda item, which is public comment. Is there anyone in public comment that would like to come forward now? BPS, is there anyone virtually?
If you would like to provide public comment, please press *9 to take your place in the queue. Chair, the public lines are open and working. However, there are no callers for comment at this time.
Thank you so much. So once again, for the folks in the audience and for those who are watching virtually, we do have a few bills that were not work session either yesterday or today. We will work with staff to ensure that we have the amendments given the short timelines that we are. And so we ask folks to pay attention to when the bill is heard behind the bar so that you are able to understand the decisions that we make. Of course, you may always follow us on Nellis to see what amendments have been added to the bills as they move forward, should they move forward. And before I conclude, I did not anticipate this meeting, and just want to express our gratitude to our committee secretary and to our staff and to our senators who serve on this board. This is the last Senate HHS meeting, and it's been an honor to serve all of you and to work with all the continual stakeholders to improve the health of our state. So thank you so much for joining us. The meeting's adjourned.